Hi everyone, welcome to Get Well with Dr. Shel. I am Dr. Shalina Lalji, better known as Dr. Shel, and I know as a board-certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshel.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. Welcome, everybody, to Get Well with Dr. Shel, which is a weekly podcast to inspire your highest health and wellness and an empowered exploration of the newest protocols and information. My guest today is Dr. Heather Paulson, a board-certified naturopathic oncologist, a teacher, a best-selling author, and a speaker. After experiencing cancer with several loved ones, Dr. Paulson left an impressive career in marine biology to attend medical school. Dr. Paulson works with people undergoing cancer treatments, including radiation, surgery, chemotherapy, and really helps patients to integrate natural remedies in order to reduce side effects and to reduce the risk of recurrence, which I think is so very important. She also works with cancer survivors to support them to feel like themselves again. Dr. Heather Paulson is the author of the best-selling book, Cancer Proof: 7 Natural Ways to Live Cancer-Free. Welcome, Dr. Paulson. We're so happy you're here.
Thank you. Thank you so much for having me. It's a pleasure to be joining you today.
Of course. Thank you. Thank you. I think our listeners and our audience are going to get a real treat. And I know that when the first time I met you, we both belong to Mindshare community, and we're so fortunate to have each other and have this wonderful group of people. But when I was diagnosed with breast cancer, I actually reached out to you, and you were amazing, and I thank you for that, and just kind of helped me talk through everything and decide how to navigate my journey personally. So I think it's really, really great work that you do. So let's jump right in with the most important question. What is naturopathic oncology? Can you let our listeners know what that field is and how would you describe it?
Absolutely. It's maybe a term you haven't heard before because there's only about 100 or 100, less than 150 of us in all of North America, including America and Canada. So there's not very many naturopaths that practice naturopathic oncology, but what it is it's naturopathic physicians, so people who have gone to 4-year naturopathic medical school, who have decided to specialize in cancer care. And as a naturopathic oncologist, I had the privilege of doing a 2-year oncology residency that was part of a cancer in a hospital in Goshen, Indiana, the Goshen Center for Cancer Care. And I got to practice alongside medical oncologists, radiation oncologists, surgical oncologists. But the team also included counselors and dietitians. We worked very closely knit with hospice care and palliative care. And we would meet as a big team several times per week to discuss every new patient that walked in our clinic or our center, and we would discuss anybody that was being referred to any other specialties, and then we had tons of tumor boards. So I really got to dive into the deep end of the pool there of how can we use naturopathic medicine, which is using things like herbs and supplements. We're trained in Chinese medicine and acupuncture. We're trained in homeopathy. We're trained in diet. How do we use that alongside all these other amazing doctors that are treating people with cancer.
Right. And I think that's, what we call just getting the best of both worlds and all worlds,
Mhm.
right? So I think even for me, from a personal setting, it was a tough decision, especially when we're so used to practicing more integrative medicine or functional medicine, we think of chemotherapy as a poison, right? We think of radiation as we're burning, we hear all of this, right? But I think it's really important to realize that we're really using clinical studies, clinical trials, and the best that traditional science has, but using the functional medicine side of it as well to allow your body to go through something that can be very taxing, right? And I
Absolutely.
think that's really where your role perhaps is incredible, because we really have to bring in the mind body component, the stress management component, but also how do we have our body handle this environment, right? First you're
Mhm.
handling cancer, then you're handling all the treatments that go with that. So I think it's beautiful, and I'm a huge fan on giving yourself the best chances possible, so you're all in and there's no regrets and there's no looking back, right?
Absolutely. In fact, that is how I came to naturopathic oncology. I went to naturopathic medical school because my father was diagnosed with stage 4 cancer when I was a young adult. And through that process, I saw with my own two eyes what was missing in his cancer care, right? There was
Right.
a huge focus on the tumor and not really such a big focus on the whole person. And I really wanted to bring that side of things of focusing on you as a whole person
Right.
to cancer care and also addressing the tumor. And then when I went to naturopathic medical school in my first year of school, my partner, then husband, was diagnosed with lymphoma.
Oh my,
And my classmates pulled me aside in the hallway and said, how could you let him do chemotherapy? He's going to poison himself. He's going to kill
wow.
himself with chemotherapy. And I looked him in the eye. I mean, I was literally surrounded by a group of people in the hallway,
Wow.
very intimidating. And I looked them in the eye and I said, I looked up this research on his particular cancer and particular chemotherapy, and it has a greater than 98% 10-year survival rate. Can you say that about anything that you're going to talk to me about in this hallway?
Right.
No, so move out of my way.
Yeah.
But that being said, what is the damage that's being done with the chemo? There, we can't ignore that it impacts our healthy cells, that it
Right.
impacts certain organ systems and our healthy tissues. So what we did during that time was hired a naturopathic oncologist, actually, because I was a medical student at the time, and we hired them to help him get through chemo. And what his oncologist would say every time we walked into the office for a checkup, and let me tell you, his chemo was not easy. It was 5 days in the hospital,
Wow.
not outpatient. It was really intense chemotherapy. And every time we walked into the oncologist's office, his oncologist would say,
What are you
you're
doing?
you're so healthy. You're one of
What
the
are you
healthy
doing?
ones. I love seeing you. You're one of the healthy
Yeah.
ones.
Yeah.
And that inspired me. I knew why I went to naturopathic medical school based on my dad's cancer experience, and then watching my husband go through his cancer experience and be, air quote, one of the healthy ones.
Right.
It really inspired me to go down this path and help more people.
Oh, good for you. Good for you. And it's so it's music to my ears to hear you say these things, because I like to get the message out, and I just did my reveal, if you will, because it's been a year. You probably remember we spoke about a year ago. I was diagnosed October 9th, 2019. And I went through the same thing, right? I mean, a lot of people in our field and who are naturalists, if you will, have this stigma against doing radiation or chemo. And and every person is an individual, right? We always say that too. There is no right answer, there's no wrong answer. There is what's right for you answer, right?
Mhm.
And you and I are of the same mindset, I believe, that patients need to be first and foremost fully informed, right? So we inform them of what's available to them from a traditional medicine standpoint, traditional oncology standpoint, but also let's not forget all of the things that we need to do to our bodies that can make our bodies the wonderful machinery that it is, right? We need to just help it heal itself, right? And protect its cells against something that's helping certain parts of it, but also may damage other parts of it. So hearing your story is just awesome, because every journey is personal. So your journey was very personal to you, right? So there was your dad, there's your husband. Is that what caused you to kind of, let go of what you thought your life would be as a marine biologist? Let's kind of talk about that. Is that what did it for you?
Absolutely. Absolutely. I only wanted to be a marine biologist when I grew up. If you asked me as a little kid, what do you want to be when you grow up? And I spent a lot of time studying even in high school, and my dad would set things up so that I could shadow with people who were in the marine biology field. And so that's what I wanted to do when I grew up. But I was spending time in the redwood forest when my dad was actively dying from his cancer, and all the things that we talk about as a park ranger in the park ranger hat and uniform, working for the National Park Service in a beautiful redwood forest, it just north of San Francisco.
Yeah, I've been there. It's gorgeous. It's
So pretty.
I mean, you feel like you're in touch with God, right?
Yeah. And standing there, we would talk about the same things I talk about with people now: how to reduce plastic exposure, how to reduce chemicals that are coming into the watershed and damaging the river and the salmon, how to be more aware of these things. And also, these chemicals are what can lead to a cancer diagnosis for many people. In fact, they think that that's one of the things that triggered cancer in my dad. He was part of a study where they were tracking surfers from Southern California that surfed during a certain time period that were getting more aggressive cancers than the average population. So a lot of the areas that are good for surfing are also outlets for storm drain systems and for the electrical company and whatever they're dumping and things. So I was inspired by my dad being included in that study, learning about that and looking, well, would people take this advice about reducing environmental exposures more from somebody in a ranger's hat or park service uniform, or somebody with a stethoscope around their neck? Yeah. And I think you might disagree, but I think you take advice a little more seriously from your doctor than the park ranger. And that's why I went to medical school, to still bring that kind of whole systems approach into cancer care.
Well, good for you. I think, everything that you're doing is just very remarkable. So tell us a little bit about what are some of the modalities that we might see explored in the naturopathic oncologic setting that, you may not see in the traditional oncology setting?
One of the main tools that I use is really supplements. That is a really important tool. I feel that amino acids are particularly important for people going through active cancer treatments, because amino acids are actively depleted by surgery, radiation, and chemotherapy. And that's usually what leads to fatigue. The way most people who are healthy know about amino acids is that that's what we use before and after working out, or when we're training for a marathon. We use that to help our muscles and our body recover from those kinds of intense activities. Also helps us build more muscle after exercise. But in chemotherapy, radiation, and surgery, our body burns through extra amino acids. And I think that's just a really important thing to focus on when we're going through active cancer treatments.
That's awesome. That's awesome. So, I know with my journey, my oncologist and the radiation oncologist were pretty amazed that I was kind of, and when I look back at it, I started my chemo in December. So I had my first round. I had 4 rounds of chemo, about 4 weeks apart, 3 weeks apart. But it was incredible because, I'd be tired for a couple of days, but I never threw up. Never. The nausea just kind of came mildly and went away. And during the radiation, I was working the whole time, and COVID was happening and so much stress was going on, et cetera. But I really think all of my juicing and my healthy eating and my infrared and my yoga and my supplements, that got me through. And it got me through in a way that when I look back in 2020, it was the year of a lot of cancer treatments. Is the year of COVID. It's the year of radiation. It's the rate of, the year of chemotherapy. It's the year of my husband having ALS. It's the year my oldest went off to college. It's the year my younger is a senior in high school. I mean, I just feel like, did I really go through cancer? And I don't mean to say this in a, I'm pushing it aside kind of a way, but all that to say that when you help your body helps you, right? So maybe let's talk a little bit about how can natural medicine help people going through cancer treatments? What do you see in your practice and in the tumor boards that you were having, which is great because you have all these multi-specialties coming together. So how
Yes.
how can that
Yeah.
help?
So the possibilities of how using naturopathic oncology or functional oncology alongside your conventional cancer care, the possibilities are endless in the ways that it can help you. Because what I see is that every person's body responds to treatment a little bit differently. Now, there's things that after doing this for over 13 years, there are some things that I can predict, and I have some core supplements that I start based on exactly what treatment or what chemotherapy you're going to be getting. Right. But then there's all these little nuances. You didn't get nauseous, but somebody else, that might be their chief concern, is they just get so nauseated. So we do acupuncture for nausea, or ear seeds for nausea. We do herbs for nausea. We do pressure points. We do guided meditations. I mean, we'll just like go all in to make sure that symptom resolves, or maybe it's hot flashes or neuropathy. So whatever is going on in your body, we can use natural medicine to help reduce that symptom and resolve it. So that's one aspect of things, is like, how do we treat any symptoms that are popping up? But another aspect is, how do we protect your healthy organ systems? So if your chemotherapy is likely to damage your heart or your kidneys, or maybe radiation is near some other healthy organ systems like your lungs or your pelvis, we want to make sure we protect any of your healthy cells from being damaged from those treatments. And one of the things that's amazing is, I was always like, oh, is this really helping? Am I really, I mean, I know my patients feel good, they're not tired, they're able to maintain work just like you were. And yet I know I say this protects the heart, but is it really protecting the heart? I know I've read the studies that say that it can, but is it? And one of my patients, after his chemotherapy and radiation, which both impacted his heart, he ended up needing to have a quadruple bypass a couple years afterwards. Wow. Not related to chemo, just other health related issues. And his cardiologist came out of surgery sharing with him and his wife that he couldn't believe he was able to do sutures in his heart, or stitches in his heart, because most people who have his chemotherapy and then add on top the radiation, their heart is so friable, which means that it breaks, the muscle breaks easily, that they can't do stitches in it. And so he was surprised that he was able to do the bypass surgery. And I was like, oh, it does work.
You're like, I did something right. That's great. Well, I think, but the body is such a mysterious thing that we have, but yet it's so responsive also, right? To the right ingredients, to the right therapies, to what we're giving it. And to your point, I think it's very important that everybody who's undergoing cancer treatments really know what chemotherapies or radiation is recommended to them. What is the what does the data say, right? What is their percent survival with, without. There's actually that entire oncotype, testing that they do, which is really interesting. Actually, let's talk about that because that's something that a lot of people don't know about. And I didn't know that much about it before I went through cancer myself, but I think it's such an important piece of making the decision. So if you'll shed some light on that.
Yeah, so there's several types of tests that can be done that look at your particular tumor dynamics. What is unique about you and your cancer? Because I never think of any two breast cancers as being exactly the same, or colon cancers. And I think sometimes when you hear that you've been diagnosed with cancer and you get on the internet or read books, it's easy to lump all this, like, yes, oh, all of this is the same, but that's really not the case. So what's great about oncotype testing is that that's specific for breast cancer, and it can look at some gene sequences not in your body. These are not gene sequences that are part of like what you pass on to your kids, but gene sequences within the tumor, and show exactly what the risk is of recurrence. Are you a low risk of recurrence? So maybe you don't need chemo and you can just do a hormone blocker, or maybe just surgery and radiation was enough. Are you a moderate risk of recurrence, in which case, as you know, things are kind of up in the air when you're in that moderate risk category? Or are you at a high risk, in which case we don't want to skip chemo, we don't want to skip radiation. There's a probability that this cancer is going to recur. Now, that is specific for breast cancer, but there are other types of gene tests that are done for other tumor types. And then if you have a more advanced cancer, like stage 3 or stage 4 disease, I really like to look at circulating tumor DNA, which does something similar. Right. And helps us determine how can we use immunotherapies, or what part of your system has the wrong switches on or off, so that we can use natural therapies to help give you the best chance of stopping tumor growth.
That's fantastic. And, really important information, because if I didn't know it when I went through cancer, and I have been in the medical world for over 20 years, I can guarantee you most people don't know this. So I think this bears a little, we need to spend a tiny bit of time on this. And I want people to know about circulating tumor cells, because it's really important to know what is your microscopic, at the microscopic level, do you have micro metastases, right? So yes, we can see metastases on imaging. You do a PET scan, you see tumors here, here, here. But if you don't have that, do you have microscopic metastases that are still in your blood? And when you do the circulating tumor cells, and there are several different labs that do it, right? So of course, being what we do, I did all of them, right? So, but the reason I did all of them is because they give different information, right? So there's Biocept, which I've done it 4 times. And thankfully, I don't even know if I've shared this with you, but I started off at 19, which is really high before I had surgery, went down to 12 after surgery. Then I did it again after chemo, went down to 6, and then went down to 1. And now I'm at 0. So I've done it. So, I think that gives you this peace of mind that you're doing the same test and you're actually seeing a decline. But then there's this other one called RGCC, which you and I know as, the Greek test. Do you want to talk about that a little bit? Because, we can actually see which chemotherapies or if radiation is, your tumor cells are going to respond to that, and which nutritional products. So that was another really important one for me.
Yeah, so to be completely transparent, I am very familiar with RGCC testing, and some of my patients choose to do that testing, but it's not for every single person. It is a hefty price tag. So and it's not covered by insurance. So most of my patients don't utilize RGCC testing, and we still get really good results. So if you're listening to this and you look it up, you're like, oh my gosh, I can't pay.
It is expensive. Absolutely. Yes. All of these are. None of these are actually covered, right? Even the Biocept.
Well, Biocept can sometimes be covered by insurance. And then I like a couple of tests that are covered by insurance. One is by Guardant 360, which should be in your regular oncologist office. And then also Foundation One, they have a circulating tumor DNA now. They didn't used to, but they do now. And then there's a couple of companies that do the tumor DNA on your actual tumor itself when it's removed from your body. That is Guardant 3, no, sorry, that's Foundation 1 and Caris.
Yeah.
Yeah, and Caris testing does that. And those should be covered, all of those should be covered by your insurance. Now, they're not testing chemo sensitivity and they're not testing sensitivity to natural products. So that is where some other brands come on board to do that type of testing. Sometimes it can be really helpful to have that information, you know, is your tumor DNA and your circulating tumor cells responsive to curcumin or vitamin D or mushrooms, or, you know, when you see this big laundry list of available supplements to people who have been diagnosed with cancer, it can be a helpful tool in discerning which might be the best fit for your body. But we can also, since I've been doing this for a long time, I can also help discern what might be the best supplements for your body based on your health history, based on some other information, like from a Chinese medicine perspective or an Ayurvedic perspective, what resonates best with your body. So don't get hung up on not being able to do some of these tests. If it's outside of your budget, you can still have success with natural medicine. But if you are a database person and you want this kind of information, it is available, which is really cool.
I think it's also important for everybody to know, ask your oncologist about it and ask for everything possible that your insurance plan can cover, right? So know that it's out there, know that there are some policies that will cover X, Y, or Z. Go in with this information and ask for circulating tumor cells. I think it definitely will just enhance the picture, right? So if we can get it, let's get it, right? Do you have to have it? I agree with you completely. You don't have to have it. You don't have to, you know, break the bank for it or anything like that. But if you're a data person, it is available. And it's important to know that there is more beyond just a cookie cutter approach. Oh, you have stage 2 breast cancer with this is the, you know, chemo we do, this is the radiation, etc. There is customization that somebody like you know, or a functional medicine doctor like me, we can offer to our patients to really give them the best of both worlds. Yeah, switching, you know, switching gears just a little bit. Do you have any thoughts or tips to help people manage the stress of a cancer diagnosis? Because that is probably the worst few words that you can ever hear. You have cancer. So what do you tell your patients?
Yeah, absolutely. So, and it's not just what I see in my practice, but it's what you and I have both experienced too, right? So this is coming from not what I think you should do as an expert. This is what I have learned in my own path in traveling with people I love diagnosed with cancer. One of the things that I think is really important is to first and foremost acknowledge that when you hear the words, it's cancer, that is a trauma. And it's been shown in research studies to be a trauma. And it's really easy to minimize and say, oh, but my cancer's, I hear this all the time in my office, my cancer's not that bad, or I'm doing okay. I'm mostly worried about my loved ones who are watching me go through this. I get it, but it is considered a trauma and it can create post-traumatic stress, not only for you as somebody with cancer, but also the post-traumatic stress scores are actually higher for our friends and our family members and our caregivers, because they watch you go through the process as observers and they can't do anything about it. And then I know for my husband, there was a lot of times that he was on Benadryl and like didn't even remember what had happened. He was on like so many we called it Benadryl nap time, you know. It's just like he didn't wake up for 3 days. But I saw everything happen, right? So our experiences are different. So the first important thing is to give yourself some compassion and some grace for going through a traumatic experience. And then once you can recognize that, get support, get help. So support groups, counselors, those have been shown to be very, very helpful for reducing the stress and even reducing cortisol levels that are associated with a cancer diagnosis. yoga and breathing and meditation. All of those things might sound like a little fluffy to talk about with your cancer diagnosis, but those have all been shown in research studies to bring down those post-traumatic stress scores and help people recover. And then now there's some new studies coming out on using things like psilocybin and MDMA for helping treat the existential dread. That's literally what they called it in the research studies, the existential dread that comes along with a cancer diagnosis. And if you've ever been diagnosed with cancer or have been close to someone, you know what that means, existential dread. It's like that fear that, like, what if I die from this? Have I had the life that I wanted? Did I do everything I wanted to do? But having those kinds of questions come up offers opportunities for also post-traumatic growth. So there is an opportunity for growth out of this trauma, but you don't have to force yourself into growth. You don't have to force yourself into being overly optimistic. That's also been shown in the research studies to increase stress markers, to be too optimistic or faking optimism, if you will. But those are just, I mean, I just threw a lot of things out there as some of the ways to treat that stress component.
Absolutely. Couldn't agree with you more. I think that, you know, recognizing and accepting that this is a big deal. This is something that is traumatic, and just exercising that self-compassion, self-care, recognizing that, you know what, this is something that I'm going through, and just meeting yourself where you are. And also for the caregivers to do the same thing. It's the caregiver syndrome, right? I mean, I think that your kids become caregivers almost, because, you know, if they're old enough, they see you go through it, and it's very, very difficult on them. And to just be there for them and letting them be sad is okay. And then really opening yourself up as a family or as an individual to cognitive behavioral therapy, if that's what you need. I know it was very important for me personally, for my family, as well as meditation and yoga totally saved me and my family. So I think those are some incredible points. When your cortisol's higher and your adrenals are imbalanced, you don't heal well. When you don't sleep, you don't heal well. You know, so those are really important components of cancer therapy. And I think when I tell my patients that this is part of your cancer therapy, this is not just an add-on, this is part of the treatment. And I'm sure you do that for your patients as well, because it's an entire treatment protocol, which has to have lifestyle medicine, right? So,
absolutely.
Yeah.
Absolutely.
So with over 16.9 million cancer survivors out there that are, you know, have recovered from treatment, let's talk a little briefly about post-cancer treatment and ongoing wellness. It feels like it's really an important conversation that we are missing, you know, for all the survivors that are out there. What happens after you've recovered?
Yes. Isn't that such a good question? I remember when my husband was done with his chemotherapy and they're like, all right, they rung a bell or sang a song or something. And they were like, all right, see ya. Bye. Yeah. And we looked at each other, panicked, like, what do you mean see you later? Like, I've been coming here every week for the past, 9 months. Like, see you later. Am I going to die? Like, what is happening? What's going to happen in these 3 months? And it's not just in that window, but it's even, for decades and years afterwards, how do we support ourselves?
Right.
And I think that one piece of that I recommend doing within the after the first 2 to 3 months after finishing chemo or radiation is to do some type of treatment to help move things out of your body. So I have a detox that I put patients through that I've tested on lots of people with post-cancer treatments. And when we first started, we detoxed people too fast and their neuropathy and nausea would come back. That's how much we were moving the chemicals out of their fat cells and out of their muscles. So we've slowed it down a bit to create less side effects, but to still be effective at moving things through. Some of the chemotherapies actually have heavy metals in them. And that's how the heavy metals is how they stop cancer replication. It's actually therapeutic, but it's not therapeutic for those heavy metals to be circulating in your system long term, or the dyes and metals from getting contrast with all of the scans. We want to move those out of your system in a really gentle way. So that would be part of a post-cancer survivorship plan in my mind. And then doing something like that at least on an annual basis to keep your body in a really great space. And then also looking at what got you here. You know, what happened? Was it a trauma? Because we know traumas in early childhood are linked to an increased risk of cancer. Okay, if it's trauma, we can't fix that with vitamin D. Like, we need to send you to somebody who specializes in that kind of care. And then keeping track of certain labs that are affiliated with an increased risk of recurrence, right, like vitamin D, like inflammatory markers, like looking at how you're managing your blood sugar, how you're managing angiogenesis in your body. Right. So that creates an opportunity to make a plan that's unique to you and your body by looking at some of these other things that influence your whole health. Cortisol is something I measure on all my cancer survivors, usually do hormone panels, because elevated cortisol has been linked to risk of recurrence. So we look at some biomarkers that are in your blood, yes, to then create the plan for you as an individual to reduce your risk of recurrence.
That's great. That's great. And I think, you know, again, just to add to what you're saying, just looking at the terrain, the microterrain of the body to make your body, you know, not conducive to cancer coming back, right? So we don't want cancer to like anything that's going on in our body. So our fasting insulin needs to be low, our inflammatory markers need to be low, you know, our vitamin D levels need to be high. So cancer comes and says, oh, I can't grow in that body, you know, to really oversimplify, but really it is what we're trying to do, is we're trying to kind of give you health and well-being back so cancer can't survive in that body. And I think that's really the end goal here, is to stay healthy long term. And stress is a huge part of that. You know, of course, the year 2020 with COVID and everything else that's gone on does not help, but we can do things to help us bring our stress hormones down. Before we finish, let me ask you about your amazing course that you're putting together, Naturally Better with Chemo program. I know it's in the beta development stage, but I'd love for you to share it with our community, and also would love to know, how can someone get in touch with you to get on your wait list? Because I know you're very popular.
Yes, thank you. Well, I developed the Naturally Better with Chemo program because I have been doing this for a long time. I've had that opportunity to work in the hospital and in private practice. And I do know some things that people should be starting off on while going through chemotherapy, radiation, surgery, to help reduce side effects. And one of my mentors said, why aren't you offering this to more people? Why aren't you talking about this more? Like, you're just doing it by yourself in your office. And I was like, what? It's not a big deal. I mean, yeah, I can like reduce side effects and help people get through chemo. Like, why do you want me to talk about that? That's what I do all day, every day. It's not a big deal. And she was like, this is a deal. People need to know about this. Yeah. So I put together Naturally Better with Chemo. We've had 2 groups go through it, and it's been really well received, and it's really helping people reduce their side effects from treatment. We have different handouts that focus on the different types of chemotherapy and exactly what supplements to avoid and which ones to take with different chemotherapies. We go through how to support your fatigue, how to support your red blood cell counts, how to support your white blood cell counts, how to reduce neuropathy, how to address insomnia, like all of the most common side effects we talk about in videos, where there are handouts and information of exactly what supplements I use in my practice when patients have these different side effects pop up.
That's great. That is such amazing information. So how can somebody get in touch with you?
Yeah, so you can get in touch with me on my website, drheatherpaulson.com, drheatherpaulson.com. And that is the best way to get a hold of me. And we also offer free consultations if you have a couple of questions to see if we're a good fit. And I am also on like all of the social media platforms. So
Okay.
wherever you are, I like to be there educating about
Great.
naturopathic oncology.
That is great. Well, this has been such a treat, Dr. Paulson. It's really great to have you on. I think everybody learned a lot, and we'll definitely put some links about you and your program once you have it, so that everybody who is, navigating cancer, whether it's during the journey or after the journey, can reach out to you and get your help.
Awesome. I look forward to supporting you. And also, I just want to say I'm so excited to hear about your circulating tumor cells coming to zero.
Thank you. Thank you. I feel blessed and I feel so grateful. And, I definitely always say that cancer is my teacher. It has been my teacher. It has taught me a great deal, and it continues to give me lessons. And, everything we go through, we can look at it as a tragedy or a blessing. And I try to just look at my cancer, my husband's ALS, as blessings of different sorts. It's taught us so much and really caused a lot of spiritual transformation, and the ability to then share our experience with everybody out there who's struggling. So we all go through it for a reason, right? It's not pain-free, but it is for a reason. So anyway, great seeing you, Heather. Take care.
You too.
Yes, wonderful having you on. Take care. Thank you so much for making time for today's podcast with Get Well with Dr. Shel. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshel.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.